The LRRK2 gene is located on the long arm of chromosome 12. LRRK2 gene mutations are associated with susceptibility to Parkinson's, leprosy, and Crohn's. In an article entitled "Protein Involved in Parkinson's Disease Also Regulates Inflammatory Bowel Disease," the LRRK2 gene makes the protein called nuclear factor of activated T cells, NFAT, which regulates the function of immune system cells. Laboratory and life studies have shown that reduced levels of LRRK2 may contribute to increased activity of NFAT in Crohn's disease. Boston University scientists are evaluating Crohn's and Parkinson's patients for LRRK2 mutations and how LRRK2 modifies NFAT inflammatory response. The anticipated outcome is to find mutations in LRRK2 expression in Crohn's and Parkinson's patients. If LRRK2 expression is reduced, enhanced NFAT activity will increase inflammation. Researchers look to suppress inflammation in Crohn's and Parkinson's disease with LRRK2 kinase and NFAT inhibitors. Mutations in LRRK2 are the most common cause of genetic Parkinson's. LRRK2 has also been recently linked to inflammatory bowel diseases, such as Crohn's and ulcerative colitis. We anticipate that the identification of overlap of pathogenic mechanisms between inflammatory bowel disease and Parkinson's disease will help us to better understand how mutations in LRRK2 elicit Parkinson's and potentially identify new pathways as therapeutic targets. At the 2013 International Conference of Alzheimer's and Parkinson's Disease, presenters suggested pathogenic LRRK2 variants might increase an individual's susceptibility to Parkinson's by weakening the immune system. An environmental trigger, such as an infection, is needed for LRRK2 to cause Parkinson's. Moreover, LRRK2 expression in these cells takes off after exposure to bacterial or viral particles, or when the cells are stimulated by the cytokine interferon, which rallies the immune system to fight infection. Tumor necrosis factor is a potent pro-inflammatory system protein and has been shown to be elevated in all experimental models of Parkinson's disease. Dopaminergic neurons are extremely sensitive to tumor necrosis factor. Michael J. Fox Foundation grant recipient Malu Tanzi and colleagues have developed and tested novel tumor necrosis factor inhibitors to relieve chronic neuroinflammation in Parkinson's disease. The tumor necrosis factor blocking agents, Enbrel, Remicade, and Humira, are prescribed for the treatment of inflammation due to Crohn's and rheumatoid arthritis, and all have been responsible for reactivating latent tuberculosis in patients with Crohn's, rheumatoid arthritis, and other diseases. According to Dr. Tanzi, the aforementioned TNF biologics block soluble TNF only and not membrane-bound tumor necrosis factor. Dr. Tanzi is working on a TNF inhibitor that inhibits both soluble and membrane-bound form of TNF. The expectation is that if it gets to the market for any therapy, it will not have side effects associated with the other anti-TNF biologics. University of California scientists are developing a fusion protein with Remicade, which has been shown to be neuroprotective in a mouse model of Parkinson's disease. And unlike Enbrel, Humira, and Remicade, the new protein crosses the blood-brain barrier. The fusion protein caused a 130% increase in striatal tyrosine hydroxylase. How can tumor necrosis factor inflammation be relieved? A good start is exercise. In addition, the Mediterranean diet. Pregnant women treated with magnesium sulfate had the frequency of tumor necrosis factor producing cells reduced by 25%, and production of interleukin-6, a pro-inflammatory cytokine, reduced by 20%. Infection is a common danger during pregnancy. Blood drawn from pregnant women was contaminated with LPS, than treated with magnesium sulfate. Tumor necrosis factor and interleukin-6 expression were decreased by 60%. In vivo, magnesium sulfate functions include decreasing maternal and neonatal inflammation associated with preterm labor, preeclampsia, and the development of cerebral palsy. Magnesium sulfate is safe and well tolerated, and our findings suggest that magnesium could be used therapeutically as a broad-spectrum anti-inflammatory agent. Seven MIT researchers developed magnesium L-threonate, and magnesium L-threonate prevents and restores memory deficits associated with neuropathic pain by inhibition of tumor necrosis factor. The drug GM1 reduced tumor necrosis factor and interleukin-6 in a treatment study of cerebral palsy patients. Ganglioside, a major component of membrane signaling domains, plays important roles in neuronal development and survival and modulates a variety of cell activities. This study provides evidence that GM1 use for 24 weeks was superior to placebo for improving motor symptoms, and that extended GM1 use up to 120 weeks resulted in a lower than expected rate of symptom progression. DHA treatment of resident brain and spinal cord macrophages, microglia, diminished production of interleukin-6 and tumor necrosis factor. The present study demonstrated that elevated tumor necrosis factor activity directly related to apoptosis, and folic acid inhibits apoptosis by inhibiting the action of tumor necrosis factor. 69 healthy women were divided into two groups. One group had regular UVB exposure via full-spectrum tanning beds once a week. The other had minimal daily sunlight exposure with no use of a tanning bed. The UVB exposure group had increased vitamin D and decreased tumor necrosis factor levels. The minimum daily sunlight exposure group had decreased vitamin D and increased tumor necrosis factor levels. The study is the first to determine an inverse association between tumor necrosis factor and vitamin D levels in a healthy population. A separate study confirmed higher serum vitamin D levels were also correlated with lower tumor necrosis factor levels. Selenite, the source of the essential micronutrient selenium, benefits embryonic stem cells therapy in the animal models of Parkinson's disease through inhibiting inflammation. Tumor necrosis factor and inducible nitric oxide synthase were effectively abated nearly by 30% and 50%. Selenomethionine is the organic form of selenium and is absorbed 19% better than selenite. Selenomethionine prevents degeneration induced by overexpression of wild-type human alpha-synuclein during differentiation of neuroblastoma cells. This protective effect was not observed after treatment with sodium selenite or methionine. Vitamin C suppresses LPS-stimulated production of inflammatory mediators in neuron glia co-cultures. Consuming a diet containing vitamin C might be an innovative approach to ameliorating neuroinflammation or symptoms resulting from acute insults to the central nervous system or chronic neurodegenerative diseases. In a viral inflammatory model, alpha-lipoic acid decreased inflammation by downregulating pro-inflammatory cytokines and preventing glial cytotoxicity. Alpha-lipoic acid, acetyl-L-carnitine, and vitamin E restored inflammatory markers to about normal levels in the rat model of Alzheimer's disease. epigallocatechin gallate, inhibits lipopolysaccharide-induced microglial activation, and protects against inflammation-mediated dopaminergic neuronal injury. Quercetin, a flavonoid fraction of green tea, is equally or more effective than resveratrol in attenuating tumor necrosis factor-mediated inflammation and insulin resistance in human fat cells. Using a cell model of inflammatory response, theaflavin suppressed COX-2 gene expression and downregulated tumor necrosis factor and other inflammatory markers. The theorubigen fraction of black tea exerts beneficial effects in experimental colitis and may therefore be useful in the treatment of inflammatory bowel disease. The amino acid theanine inhibited oxidative stress, which included the increase of tumor necrosis factor. Theanine also protected against Parkinson's disease-related neurotoxicants and attenuated the downregulation of brain-derived neurotropic factor. In the CoQ10 segment, serum levels of brain-derived neurotropic factor correlate with motor impairment in Parkinson's disease. The pre-intake of carnosine significantly attenuated MPTP-induced glutathione loss, retained the activity of glutathione peroxidase and superoxide dismutase, diminished oxidative stress, and lowered inflammatory cytokines. In an article entitled N-acetylcysteine in the Treatment of Parkinson's Disease, What Are We Waiting For?, NAC also inhibited tumor necrosis factor by the preservation of mitochondrial integrity. DHEAS, dehydroepiandrosterone sulfate, inhibits tumor necrosis factor production in monocytes, astrocytes, and microglial cells. Experimental and clinical data showing that melatonin reduces adhesion molecules and pro-inflammatory cytokines, including interleukin-6, 8, and tumor necrosis factor. Eclonia cava extracts suppress the production of tumor necrosis factor alpha. Tetrahydroxystilbene glucoside, an active component of Polygona multiflorum, attenuates neuroinflammation through the inhibition of microglia activation. Asiaticoside dose-dependently inhibited LPS-induced fever and inflammatory response, including serum tumor necrosis factor and interleukin-6 production, through the upregulation of the enzyme heme oxygenase 1. In neurodegenerative diseases such as Alzheimer's, Parkinson's, and MS, heme oxygenase 1 expression is increased, presumably reflecting an endogenous neuroprotective response against ongoing cellular injury. Nicotine pretreatment considerably decreased microglial activation with significant reduction of tumor necrosis factor alpha. This study demonstrates that concentrations of caffeine that are relevant to human consumption consistently suppress production of pro-inflammatory cytokine, tumor necrosis factor in human blood. Apigenin and luteolin protected the dopaminergic neurons, probably by reducing oxidative damage, neuroinflammation, and microglial activation, along with enhanced neurotropic potential. Pretreatment with minocycline significantly inhibited the rapid and extensive production of tumor necrosis factor mediated by LPS in glial cells. Rifampicin inhibits microglial inflammation and improves neuron survival against inflammation. In addition, piperine depletes inflammatory markers, tumor necrosis factor, and interleukin-1 beta in 6-OHDA-induced Parkinson's rats. Coconut oil contains roughly 60% medium and 40% long-chain triglycerides. 20 intravenously fed, malnourished patients were randomly allocated to receive either 100% long-chain triglycerides or a mixture of 50% medium and 50% long-chain triglycerides for 30 days. TNF production was significantly elevated at 30 days in the LCT group, while not significant differences were detected in the mixed group. This may be beneficial in seriously ill cachectic patients. Cachectic, having cachexia, physical wasting with loss of weight and muscle mass due to disease. Cachexia is a secondary Parkinson symptom. Cachexia is a secondary tuberculosis symptom. Thus, high concentrations of tumor necrosis factor induce shock-like symptoms, whereas the prolonged exposure to low concentrations of tumor necrosis factor can lead to the wasting syndrome called cachexia. Cannabinoids ablate release of tumor necrosis factor and wrap microglial cells, stimulated with lipopolysaccharide. The oral administration of cinnamon water extract to mice significantly decreased the serum levels of tumor necrosis factor and interleukin-6. The results showed that silymarin significantly inhibited the LPS-induced activation of microglia and the production of inflammatory mediators, such as tumor necrosis factor alpha and nitric oxide. Thus, nicotinamide has an inhibitory effect on tumor necrosis factor alpha production that may be beneficial to TNF-alpha-mediated diseases. Furthermore, niacin significantly decreased tumor necrosis factor production in lipopolysaccharide-treated wild-type macrophage cultures. Resveratrol inhibited LPS-induced expression and release of tumor necrosis factor, interleukin-6, and other inflammatory markers in both cells with more potency in microglia. Coenzyme Q supplementation at 300 mg a day significantly enhances antioxidant enzyme activities of superoxide dismutase, catalase, and glutathione peroxidase, and lowers inflammation in patients who have coronary artery disease during statin therapy. Xanthoumol significantly inhibited the excessive production of inflammatory mediators, nitric oxide, interleukin-1 beta, and tumor necrosis factor alpha. There are multiple studies showing curcumin relieving tumor necrosis factor inflammation. Pterostilbene has been shown to reduce the levels of pro-inflammatory cytokine markers, including COX-2 and tumor necrosis factor, both in vitro and vivo. Pterostilbene attenuates lipopolysaccharide-induced learning and memory impairment, possibly via inhibiting microglia activation and protecting neuronal injury in mice. A 2012 study published in Neurology stated that people who eat 2 or more servings of berries a week are 25% less likely to develop Parkinson's disease. A pharmacological composition combining pterostilbene and curcumin for the treatment or prevention of oxidative stress, treatment of digestive disorders, including inflammatory bowel disease. The opioid antagonist naltrexone blocks acute endotoxic shock caused by LPS by inhibiting tumor necrosis factor production. In a Crohn's disease study, 17 patients with active Crohn's went on LDN for 4 weeks and 89% exhibited a response to therapy. 67% achieved remission. Thalidomide reduces tumor necrosis factor alpha and interleukin-12 production in patients with chronic active Crohn's disease, and thalidomide placed 4 of 7 patients into remission. The scientists at NeuroResearch also have a Crohn's abstract. Within 5 days of achieving the necessary balance of serotonin and dopamine, the patient experienced remission of symptoms. The remission has been sustained without the use of any Crohn's disease medications. Nardil is an antidepressant and non-selective MAO inhibitor. A 33-year-old woman with an 18-year history of Crohn's had a depressive episode, and Nardil was prescribed. At 30 milligrams 3 times a day, in 30 days, her Crohn's went into remission. A clinical trial for Crohn's and the antidepressant Wellbutrin was completed in 2006, and no results have been published. Bupropion is a TNF inhibitor. The antidepressant bupropion lowers production of tumor necrosis factor alpha in mice. The 2003 article, Crohn's Disease Remission on Bupropion, chronicles 6 patients who achieved remission through Wellbutrin therapy. A comparative study placed 23 Parkinson's patients on an SSRI and 23 on bupropion. Comparison of the changes from baseline to endpoint revealed significantly greater improvement in both depressive as well as motor symptoms of Parkinson's with bupropion. Bupropion has both serotonin and dopamine reuptake inhibitory action. Thus it provides more improvement in depressive as well as motor symptoms of Parkinson's disease, as well as suggests the role of dopamine in depression associated with Parkinson's. Wellbutrin improved the conditions of both Crohn's and Parkinson's patients by simultaneously inhibiting tumor necrosis factor and increasing neurotransmission of 2 catecholamines, dopamine and norepinephrine. Parkinson's and Crohn's disease patients have dopamine and norepinephrine deficiencies of the brain and gastrointestinal tract, and bupropion, the active ingredient of Wellbutrin, blocks the transport of both dopamine and norepinephrine, thus increasing their levels. Toll-like receptors are microbial sensing proteins that can detect a broad range of human pathogens. Toll-like receptor 2 is a common source of inflammation in Parkinson's disease. The long arm of chromosome 4 is associated with susceptibility to Mycobacterium tuberculosis, and this is the site location for toll-like receptor 2. Toll-like receptor 2 is increased in neurons in Parkinson's disease brain and may contribute to alpha-synuclein pathology. Given that neurons accumulate alpha-synuclein in Parkinson's disease, our results suggest that toll-like receptor 2 is of central importance in understanding how the disease starts. Opsona Therapeutics is developing a TLR2 antagonist, OPN305, to reduce inflammation for diseases like rheumatoid arthritis and Parkinson's. OPN305 does not cross the blood-brain barrier and has to be administered directly into the brain in animal models of Parkinson's disease. If OPN305 reduces inflammation and proves to be neuroprotective in animal models, it will be redesigned so it can easily enter the brain and treat Parkinson's disease. Thus, our data demonstrate that curcumin inhibits TLR2 gene expression and function possibly via oxidative process.